about health. And in developing countries, people are suffering from disease due to poor living conditions. Let's say in Africa, water pollution is caused by urbanization, deforestation, damming of rivers, destruction of wetlands, industry, mining, agriculture, and energy use. Approximately 1.6 million Africans die of malaria, tuberculosis, and HIV-related illness in 2015 years. Globally, 50% of children under 5 who die of pneumonia, diarrhea, measles, HIV, tuberculosis, and malaria are in Africa. In the whole of Africa, 215 million people were experiencing hunger, which is nearly 20% of the population. At least 12.8 million children are acutely malnourished in the region. These tragic events are happening every single moment in the world. So, do these people have rights to receive medical attention? When their government is unable to solve their difficulties, who are going to support them? The answer is global organizations. There are a lot of organizations are providing health aids to patients that are unable to receive treatment. In this video, we will introduce a few of global organizations. First is World Health Organization. It is a specialized agency of the United Nations responsible for international public health. WHO promotes health, keep the world safe, and serve vulnerable. It plays a leading role in several public health achievements in communicable and non-communicable disease. The main contribution is reduce number of deaths among children under the age of 5 and decrease the rate of underweight children under 5 years old and decrease new case infection of HIV. WHO also eliminated smallpox in 1979 years and reduced new infection of AIDS. The International Committee of the Red Cross is a private humanitarian institution. The official mission of the ICRC is to stand for the protection of the life, dignity of wisdom. In 1833, it was founded to improve medical service on the battlefield. It is supporting the national societies with disaster preparedness through the education of voluntary members and the provision of equipment and relief supplies. Apart from that, it also supports local health care projects. Number 3 is MedShare. It is a national non-profit organization. The Southeastern Distribution Center is in Decatur and Georgia, where Western Region Distribution Center is in San Diego and California. The main contribution is collect surplus medical supplies and use equipment from U.S. hospitals. Moreover, offers hand-on volunteer opportunities for people to get help in vital medical supplies. Besides that, MedShare also donated surplus medical supplies and equipment around the world. Lastly, MedShare provides medical supplies to medical professionals traveling abroad. The fourth is the Daughter of the World. It is an international human rights organization providing emergency and long-term medical care. When the crisis is over, the terminal leave, they stay for as long as it takes to build better medical infrastructures. The main contribution is open polyclinic in Athens that provide primarily medical care and physical, social, or social support service. Besides that, Daughter of the World also fighting malnutrition in rural communities. 2/3 of the world has run an emergency response specifically in areas not yet receiving any humanitarian aid. They are providing malnutrition screening and treatment while referring severely malnourished people to local hospitals. This organization takes the lead to battle with disease and take roles to shape the research agenda. Furthermore, health organizations take the responsibility for building a strong foundation of evidence-based science and ethical policies. Without this organization, uncountable lives will fail. Their dedications are priceless. In conclusion, we should pay attention to health topics for this developing country and try to support them as we can. That's all for our presentation. Thank you.